She loves to tell her story, and she's going to come up here in just a second and just give you a brief synopsis of her story and her care. But before she does, I have one patient who began seeing me back in, I believe, March, and she's since moved to Nashville, but she comes back once a month to make sure she gets checked. This is her story, and I told her I was going to read it because she wasn't going to be able to make it here today. I was really sick about a year before I first saw Dr. Blue. I've had health issues all my life, but they all suddenly got worse at the same time. My asthma got so bad that I couldn't walk across a room without an attack. I was in constant pain and became very weak. Before I discovered Upper Cervical Care, I went to see 5 different doctors. I was diagnosed with carpal tunnel, social anxiety disorder, fibromyalgia, inappropriate sinus tachycardia, insomnia, sleep apnea, but none of the doctors could find the cause. Instead of treating the cause, they treated the symptoms, which resulted in a lot of medicines. She was on 15 different medications at one time. I thought I would be sick for the rest of my life. Then I found Upper Cervical Care. My chiropractor, who she was going to see a general chiropractor, was having trouble getting any lasting results. So she referred me to Dr. Blue in Upper Cervical Care. After taking several very precise x-rays, Dr. Blue told me that he thought he could help. I had a pretty severe subluxation, which Dr. Blue explained could be the root cause of all my problems. Unlike my other doctors who just medicated me and told me that I have to live with my problems, Dr. Blue began to treat the subluxation and everything started to get better. In only a few months, I went from struggling to walk across a room to being able to run. My pain decreased drastically and my asthma is better than it has ever been. One of my other doctors wanted me to wear a CPAP mask for the rest of my life, but thanks to Dr. Blue, I don't have to. My heart problems are clearing up, my carpal tunnel is gone, and my insomnia is no longer an issue. After some of my adjustments, I even started to see better. I am very glad that I found Dr. Blue in Upper Cervical Care. Can anybody guess how old this patient was?
30?
She was 22 years old. And had all those problems. So, you know, what Upper Cervical doctors do, and reiterated in that in the video, is look for the cause. You know, I don't treat the symptom or the condition or the disease. I want to look for the cause. And if you had any type of trauma in your life, whether it be an accident or whether it be from toxins in your system or whether it be from just overall stress, those 3 things can create problems within your body. And if there is a way to find out if your body is growing a disease process, I would hope that you would want to learn about that. Robin. This is Robin. I introduced her earlier, but she's going to give you just a little brief synopsis of
Vertigo.
There you go.
I had vertigo. I was born on high-risk anemic. I was in a coma when I was 2. A number of things. I couldn't, my balance was way off. I would look up and get sick, run to the bathroom, couldn't stand still, couldn't hardly walk. Many things. And I heard about Dr. Blue in Rio. And he checked me. He adjusted me. And first time in 40-some odd years, I laid on my back. I actually went to sleep and looked up, didn't get sick, didn't run to the bathroom, had my balance, didn't have to hold on to walk. Wonderful. New life. It's like a new life. It really is. You have problems? See me. I don't really know a whole lot much to say other than he's my personal miracle.
What did the doctors that you saw before tell you?
Well, I had vertigo, inner ear, balance problem, and there was absolutely nothing that they could do. No medication. Oh, they can give me nausea medicine, and they can give me sleep medicine, put me to sleep, but they couldn't fix it. There was no way, nothing they could do to fix it. My carpal tunnel has ceased. came back, and of course, when the female sister comes to visit once a month, it's not even half as bad as it was. I was bedridden, used to be, when I was on my monthly bill. And now I've had it several times and nothing. No effects, nothing. It's great. It's wonderful.
Thank you. Now, to finish off, I would just like to open up the there's a few people in here that haven't never kind of heard of Upper Cervical and things like that. I want to open up to any questions that I may be able to answer for you. You can just fire me. If I don't know, I'll definitely get you the answer and get back to you. But hopefully, I know. But it's always a kind of a Russian roulette when you open the floor to questions. But do you have any questions that anything that you know about, anything that you experienced, anything that you heard that I can possibly answer any questions for? Don't be shy. I already had you answer something. Go ahead, Tom.
So how long do you recommend this treatment to last?
Well, I say it like this. You do painting and working on homes, right? Now, if you come and you paint my house, am I never going to need my house painted again? Nah, that's not a possibility, right? All right. If you go to the dentist, the dentist say you need the brush, you need the floss. Does he say, okay, I'll never see you again? Excuse me, they don't say that. Once we get and find that there's a problem in the upper part of your neck and we correct that, the goal is to get that stabilized and get your body holding. And I say it in my office, holding is healing. If you're holding your adjustment, your body is in a healing state. My job is to adjust you as least as possible. I'm not selling you adjustments. I don't want to adjust you over and over again. I want to adjust you properly and then allow your body to hold so that I can close that chain of communication so that your body can start to communicate with your brain and start the healing process. So to answer your question, I'm looking for patients that want to take full advantage of taking care of themselves and learning how to be taught to monitor whether or not their body is growing health or growing dis-ease. So I want lifetime patients. Lifetime patients creates benefits for not only themselves but for their families, for their friends. Because once they get it, like Robin, she has told people as far as tourists coming into Gatlinburg to on vacation in Nashville. And a guy called me on his way through here doing business and said he met Robin at bed and breakfast and wanted to come see me. And so once I help or can help or see if I can help a patient or a person get their body and get their life back, then I hope that they become advocates. And then it just becomes a maintenance thing to where you come in once a month. Once we get everything stabilized, where you just come in once a month and periodically to get checked and to make sure that that bone isn't on its way to being misplaced. Because our bodies, we go through things on a daily basis. There's stressors, there's traumas, there are different things our body has to deal with and adapt to on a daily basis. But if your body is in the right state to deal with those things, then that's when you can look forward to a cruise ship in retirement. That's when you can give your body the best opportunity to live to 100. Because not only once your immune system start functioning well, from your nervous system working correctly, everything else can take shape from your nervous system. Now, we're giving you some information, some literature to take home, to read, explaining the role chiropractic plays in health and how you just might be able to do enough things right to live to 100, or at least give your children, your grandchildren a greater opportunity to live to that age. Please do yourself and your family a favor and read this information. It could possibly make a difference in not only your health but also your life. If you have any other questions, I'll be happy to answer them. I have included, as you see, a health certificate on the front. like to schedule a time to come in and talk to me a little further, my wife has a scheduling book over there, and she can schedule some time at my earliest convenience where we can get you an appointment and you can come in and see a little bit more about what it is I actually do in the office, and see if you do have a subluxation that could be causing a slow process in your body. Any other questions?
It is amazing to 1 minute or when I walked in your office, I had vertigo 100% all the way. But when I got up off your table, I had no vertigo. It is amazing the difference in that instant. It's a world of change. It is so worth checking it out and getting fixed if you need to. You will be completely amazed.
And my technique, like I said, doesn't require any twisting, turning, or popping of the neck. There's, as you heard about the deaths from medical, there has been no one ever to die from chiropractic. There have been some rambunctious, if you will, chiropractors that use a little bit too much force in their correcting and their twisting, turning, popping that cause some neck strains and things like that, but no deaths. So I can at least say that for the general chiropractor. But for an upper cervical chiropractor, the only pain that you have is the pain you come in with, and hopefully by the time you leave, that's not the pain that you have anymore. It's like opening a dam. When you open a dam and freeing that subluxation opens a dam of nerve flow to your body. And only your body's innate intelligence knows and can establish what is normal within your body. All the classes I took, all the books I read, all the things that you may have heard, all the things you may know, fail in comparison to what the body knows and how to run itself. It just needs that proper fuel and that nervous innervation to get it to where it needs to be. So, any other questions? No, thank you all for coming. And if you need anything, please do not hesitate to give me a call. And I would love to talk to you a little further.